Good afternoon. We are the group of the Clinical Research in Nursery Learning Unit, which is in charge of the teacher Monserath Mariscal Delgadillo. The members are Reyes Alonso, Ríos Tania, Robles Samantha, and Rodríguez Estefanía. Our poster is entitled Nursing Care Process for a Patient with High Blood Pressures and Several Dehydration from the Perspective of Non-Appender. By way of introduction, dehydration is a state in which the body lacks the necessary amount of water to function optimally. So in this rich project, we will address the comparison of the use of intravenous solution in geriatric patients with arterial hypertension and severe hydration. Taking this into account, we decide that the science non-offenders health promotion model was the best option to optimize the stern tension. The objective of our clinical case is to use non-offenders health promotion model to compare intravenous solution in geriatric patients with arterial hypertension and severe hydration, taking into consideration the evaluation of individual needs and the promotion of cell efficacy in order to design the guide of interventions to be carried or advised of the review and evaluation of patients, which coincides with our PICO research question. Our clinical case is an 89-year-old male patient admitted to the emergency department due to a possible intestinal obstruction and several dehydration. Approaching this case from the perspective of non-offender, we focus on health promotion and patient care in the following areas: individual needs, history of high blood pressure, and diabetes mellitus, which place you at risk for health complications, present symptoms of dehydration, including cutaneous sinks, diarrhea, abdominal pain, and concentrated urination, experiences generalized weakness and disorientation. He has her daughter as her main support. Promotion of self-efficacy. There is limited physical activity and generalized weakness.
As part of the care plan, we must mention that the nursing activities we will mention result from a systematic review of the most recent articles related to our clinical case, focused on the most relevant diagnosis, which is fluid volume deficit, with determining the management of fluids electrolytes as the primary intervention. Therefore, the activities to be carried out are placement of a peripheral line to administer IV solutions. Use glucose in saline solutions to rehydrate the patient. Initiate unscheduled oral infusions following IV infusions. Monitor for changes in respiratory or cardiac status that indicate fluid overload or dehydration. And use glucose-based reduced osmolality rehydration solutions. After the implementation of these activities, we were able to observe that the results were modified in the following way. The electrolyte balance results went from moderate deviation from the expected range to no deviation from the normal range. The cardiac perfusion result went from a slight deviation from the expected range to no deviation from the normal range. And finally, the result of intestinal continence went from sometimes demonstrated to frequently demonstrated. Therefore, we can conclude that by focusing our interventions and activities on the personal factors that Nola Pender mentions in her model, we managed to obtain positive change results in our patients. In turn, we can guide and help his family member in the care, what she should do so that a new problems doesn't arise, so that David can live a whole life with better health and lifestyle.